Why we must bloom. I want to rephrase the statement to be why it is that we must explicitly focus on being pro-Black in the work that we do of focusing on health equity and early relational health. What we do know from statistics is that our Black babies are 2 to 3 times more likely to be born preterm or to die before their first birthday. We know from the maternal health literature that Black birthing people have the highest rate of infant mortality of any ethnic group in the United States and are 4 to 6 times more likely to die from pregnancy related causes. There are also statistics that even when you control for social economic status and education, so myself as a mother of 3 Black sons, my risk of my child dying was higher than the risk of any white person who didn't have a high school education, right? And so figuring out why it is that we have such high rates of morbidity and mortality is really important, and being able to be solution driven in order to accelerate equity and reduce these disparities. What we also know from a scant amount of literature is that when Black babies are taken care of by Black providers, you actually are able to reduce those disparities. We see this tracking across the life course and fabulous studies that were done in barbershops, that when Black males are actually talking to Black patients around things like hypertension and diabetes, you actually can improve health outcomes. Next slide. So what we do know is the current system of care for Black families is often rooted in historical inequities and fragmented. And that translates down to our babies being exposed to increased parental stress, increased morbidity, increased rates of things like asthma, obesity, diabetes in the long term. They tend to have higher experiences of ACEs, which are adverse childhood experiences. And we know trauma really can get underneath the skin and lead to poor health. Next slide. All in all, the summation of what I just shared is that the current standard of care, particularly for our Black and Brown families, is unacceptable. And there's a strong desire to reconstruct pediatric primary care. The Bloom Clinic was really born out of the brilliance of our Black identified staff, co-created with our Black families.